Hello everyone, this is Dr. Rutuja Lokhande and I work as a consultant dermatologist in Pune. Now, each one of us must have faced the problem of hair loss at least once in your lifetime. There are many reasons for the hair loss. Today in this video, we are going to discuss a very common cause of hair loss, and that is called as tractional alopecia. Now, what is tractional alopecia? As the word suggests, traction means pull and alopecia means loss of hair. So the hairs which are lost due to the constant protracted pull on your hair is called as tractional alopecia. Males as well as females, children as well as elderly, anyone can suffer from this type of alopecia. In females, this pattern of alopecia is generally seen those who tie their ponytail very tightly or weave the braids very tightly, or few females have a habit to twist their hairs and then tuck it with the help of a clip in a very tight fashion. So these females generally experience the hair fall in the frontal area. The frontal hairline keeps receding and the forehead looks bigger and bigger over the period of time. In males, this kind of alopecia is seen in those people who tie the turban very tightly on a regular basis, or they make a ponytail or a pigtail of the hair and then tuck it inside their turban. So the hair loss is seen generally in the surrounding of the pigtail. So in few patients who use wigs or hair patches to cover the bald areas of the scalp, in those patients also we can see tractional alopecias along the margins of the clips which are used to attach these hair patches on the normal hairs of the scalp. Okay. Now, what can be done to stop this type of tractional alopecia? First thing is to stop tying your hairs tightly immediately. Because what happens in initial days, body tries to regrow these lost hairs. But if this type of traction is continued over a period of months and months or years, then an inflammation sets in at the root of the hair follicle. This may also lead to the formation of the red bumps on your scalp. They may cause lot of itching also. And the hair follicle starts getting atrophied slowly over a period of time, and a day comes when there is a complete loss of the hair follicle and no hairs can be grown at those areas. So it's very important to stop tying your hairs very tightly on a regular basis. I would suggest you all to visit your nearest dermatologist if you are already facing such type of problem. Your dermatologist will find out whether the hair roots are still viable or they are completely atrophied. If your hair roots are still viable, your doctor may suggest you some kinds of medicines and lotions which will help you to regrow these hairs back. And unfortunately, if the hair follicles are already atrophied, then hair transplant is the only option which may give you your hairline back. So, I request all of you to do not tie your hairs tightly on a regular basis. Once in a while, it's okay to have a hairdo which requires tight tying of your hairs, but not on a regular basis, not at the cost of your scalp health. So stay healthy, stay safe. Thank you for the patient listening. We'll see you soon. Thank you so much.